I was having problems with illnesses, feeling tired, despite my food choices being what I thought were great choices, better for me than what I had done in previous years, exercising regularly, getting the right amount of sleep. I still continued to feel tired, run down, having little subtle illnesses that I decided I needed to see my other physicians about. My initial diagnosis was given on a Friday morning, just after I had had some routine testing done the previous Tuesday. When I got the phone call on Thursday evening and the nurse would not give me the report by phone, I knew what I was about to prepare myself for. And as I sat down with that physician on Friday morning, he told me that there was no time to wait, that not only was I dealing with the diagnosis of a very aggressive, high reoccurrence cancer, but there was actually 2 types of cancer that I was about to battle. I went away from that appointment feeling very frustrated and confused, but also really scared because I knew what I was up against physically, because I felt so compromised already over what I had dealt with for the previous year. After I had seen my oncologist the following week, my family, friends, and the physicians all were giving me advice and pulling me back towards surgery and the traditional pathways and treatment. After 2 decades of practicing as a registered nurse, I had seen the effects of radiation and chemotherapy in patients. And even in the midst of caring for those patients, I just thought, is this really worth what they're going through? And I knew that that was not a route that I would take for myself. I knew that I needed to make those decisions for myself. I didn't want those choices made for me, and I wanted to know what my options were. But my medical physicians could not give me those options, would not give me those options. They had already started making those decisions for me long before I ever had walked into those offices. And that pushed me to look for myself, what was going to be best for me, what was going to help me heal and treat the causes of the cancer, not just the symptoms. I came to 2 different physicians and they're looking at me with these puzzled looks and saying, uncommon patient, uncommon cancer, uncommon time. So for me, it wasn't a common fix. It wasn't going to be that traditional fix that addressed my issues, because everything about what I was dealing with refuted the norm, was not part of those statistics. So I determined I was going to be my own statistics. The initial recommendations were to go to surgery as soon as possible. And I knew, based on the way I was feeling and the experiences that I had had over the previous year, that my body could not handle surgery immediately. So I decided I had to look at some non-toxic formularies. I don't believe in coincidence. I don't believe in luck. I believe there's only God. And when I left my physician's office the morning I was diagnosed, the first place that I went to was Peak Family Health. I knew when I left the parking lot that that was where I needed to be, that was where I was going to find my answers, and that was where I was going to find my resources for my strength and my healing. I was already receiving chiropractic care, but I didn't feel at that point it was enough. So I increased those visits, sometimes twice, sometimes 3 times a week. And I went to hyperbaric therapy, and I did lymphatic therapy. There were many formularies and suggestions that I found in the Cancer Killer's book that helped me become the best me and defend myself that I could before the surgery ever occurred. I had my surgery 8 weeks after the diagnosis in July. I'm doing great. I will be having my first 3-month checkup at the end of October, and I have felt better these last 2 months than I have probably felt in the last 7 years. Through this experience, I've definitely become more mindful on looking at my health in a respectful manner, not determining it just because of how I feel, how I look, but knowing that I'm doing my best to take care of myself, mentally, physically, and spiritually. I know that what I'm doing is the right choice for me, and I know that it has helped to heal my body. The last recommendation after the surgery was to have radiation treatments, a safe dose. they called it. It was the maximum lifetime dose. If the cancer came back, there were no other options. There's no other organ to remove. It's most likely going to be lymphatic. And so I have chosen to lean on those resources that were provided to me through the Cancer Killers program to enhance my immune system and continue on the path that I'm on, and I wouldn't change it for anything.